Okay, so in this demo, I am going to show you how to get started with the Patient Data Hub, and this will be all the first steps that you need to process through to get to your dashboard where you can begin to both enter responses to the RUNX1 research program's questions about your health, as well as work with the patient tools in the system. So to get started, I am working from our RUNX1 Patient Data Hub section of our website. And so there are lots of different pages where you can read about the Data Hub and privacy and how to get help. But I'm going to start with the Getting Started section and clicking on the Create Your Account here. And this will bring us to the Matrix system and specifically the user request page within the Matrix system. So this is the page where you fill out the basic information required to set up an account in the Matrix platform. You'll know that it's us. It's the RUNX1 Patient Data Hub because you'll see the RUNX1 logo at the top. So I'm going to start by entering in Amanda Egan Test. I'm just making up a last name here. And I'm using a test account called RUNX1 Test Patient at gmail.com. And I'm going to attest that I'm 18 years of age. Everyone who sets up an account has to be 18 years of age or older. Younger individuals can participate, but they'll need a parent or other legally authorized representative to set up an account for them and to consent for them. So you are welcome to participate from anywhere in the world. I am in the US. And then for those who are not, you'll have to verify that you read and you know that you're providing data that will be transmitted to the US for account creation because that is where Matrix is set up. There are different roles. You can read about the different roles that you could play in setting up an account. You could be a patient yourself. You could be a caregiver of another patient, like a child. You could also be a person who has lost a loved one who wants to enter information about that loved one. So perhaps your grandparent has passed away, but you know they had RUNX1 FPD, and so you might select that. You can select all three, but for the sake of simplification in this demo, I'm going to just sign myself up as a patient. So great, I got the check mark, I registered, and then I know an email will be sent to my account to verify that email. So let me jump over to my account. It might take a minute. So I'm in my email account now, and you'll see an email from the RUNX1 Research Program, which is actually our Patient Data Hub account, Patient Data Hub at runx1fpd.org. So you might consider adding that account to your sort of not spam list to make sure you get emails from that account. Okay, so account creation notice email. I'm going to open that and my account's been created. So I'm going to click create password. Okay, so these pop up because Google and many systems are very careful for us, and that's a nice protection. But we know that because we have this logo and this email is from this email address, we are safe. And I'm going to click open anyway. So that's going to bring me back to the Matrix Create Password page. Not back to it, but it opens a new tab as you can see here. And I'm going to follow these rules and set up a password. Type in the same password there and click continue. Okay, so this is the first page of the informed consent document. This will walk you through all of the specifics about the study as you consider whether to finish enrollment. So the first step is to indicate that you are indeed 18 years or older. And then here are some details about what the data is, what you'll be asked to do if you participate, the fact that you will receive compensation for your time completing it for the first round. There is a link to open the glossary of terms on our website should you want to refer back to them, and a link for opening the frequently asked questions as well, which you may want to refer to. So I'm going to go back to Matrix and click and go and scroll down through and click next for the next page. How will information be analyzed and shared? That will be, there's a little information in there. But if you have questions or concerns, you can reach out to myself or the governing body, the Genetic Alliance and Independent Review Board is a board that reviewed the study details to ensure that they are safe and ethical for patients to participate in. You can reach out to them directly if you have any questions or comments. Contact information. We have a few questions about whether you would like to provide your information or a doctor's information should we in the future with our research find something that might impact your medical care. You can opt to say nope, I don't want to hear anything, or yes, I will provide my name and phone number and email address for you to contact me. I'm going to say no for now just to simplify the process. Again, you can fill out a doctor's name if you'd like us to contact them. And then if you want to include a family member, should we have trouble reaching you, you can do that, or, friend, whoever you choose to include there. And so finally, the last step is to agree to participating in the study or not. If you hit unsure, we will reach out to you and answer any questions that might remain. We can walk you through this process and go to and discuss any issues you have or concerns. So for now, I'm going to click yes, and by typing my name in, I and clicking complete, I will complete the consent process. One thing to note is at the bottom of each form that you fill out or survey, you'll see that you can click that you would like a copy of whatever you're about to complete sent to you. So it will be sent to that email address you registered. Note that if you don't click that, you can actually access these documents within the system later, print them, download them, whatever you want to do. So I'm going to click complete, and that will complete the consent process and bring me to the general information tab here. In red are required items. We need to indicate what country we're in. You can type date of birth in, or you can select it from the calendar. There is an option for people who suspect they have RUNX1 FPD or strongly suspect it but haven't been fully tested yet to participate. But I'm going to participate, so I would select that if that applies to me, but I'm going to participate as a RUNX1 familial platelet disorder individual. This brings me to the genetic test upload section of the enrollment process. Technically, one thing you should note is you can move on and complete this section without a genetic test report. For example, if you're someone who highly suspects you have RUNX1, but you haven't been tested yet, or you haven't gotten your results from that test yet, you can select this and move on. But we encourage you to go ahead and upload your report here so that we can have our genetic counselors review it, confirm that you're eligible for the RUNX1 Patient Data Hub before you go any further, and spend a lot of time. And then perhaps we find that this isn't a good fit for you, and you've sort of lost some of your personal time. I'm going to go ahead and upload a document. Note that it's best for you to combine any pages. If you have separate documents, separate pages and different documents, please go ahead and merge them into one document. Let us know if you have any questions on how to do that. You can upload JPEGs, pictures, PDFs, PowerPoints even, or documents. I'm going to go to upload this example genetic test report that I have prepared and click save. It's uploading now, and I'm going to close this pop-up and you'll see it right here, and I'll click complete. And I have completed this step, and so therefore now I can finish this whole window was for this section, and so now I can click finish. Okay, and I've been directed to the dashboard. That means I'm fully enrolled and I've done all the steps required to be in the RUNX1 Patient Data Hub system.